Recording in progress.
Good morning, and thank you for joining us for today's press conference. If you need access to record or would like to ask a question, please indicate so in the chat. We will limit questions to one question per outlet today, and we are limited to 1 hour. If there are remaining questions in the queue when we conclude and you feel your question hasn't already been answered, please submit your questions in the chat or by email, and we will work to get you a response in writing. Thank you again for joining us, and we will begin in just a few moments after we grant recording permissions. Okay, I believe all permissions for recording have been granted. If you requested permissions in the chat, you should now be able to record. If you still need permissions granted, please leave us another message in the chat and we will double check. Dr. Vanderhoff, we will now hand it over to you to begin today's press conference.
Well, thank you very much. Good morning. Thank you for joining us today. I'm Dr. Bruce Vanderhoff, Director of the Ohio Department of Health. While COVID-19 continues its rapid spread across Ohio and the United States, driven now largely by the Omicron variant. Indeed, our 24-hour COVID-19 case counts are repeatedly breaking records. We also know that not all COVID-19 cases are created equal, with infections ranging from asymptomatic or mild to life-threatening. While many vaccinated individuals have had mild to moderate cases of COVID-19, our vaccines continue to offer remarkable protection against hospitalization and death, just as they were designed to do. So as COVID-19 evolves into an endemic illness, rendered less severe for many by vaccine-based B and T cell immunity, the impact of this increasingly contagious virus on hospitalizations among the unvaccinated remains a very serious concern. Our state is experiencing the highest number of COVID-19 driven inpatient hospitalizations, ICU admissions, and patients on ventilators that we have seen throughout the entire pandemic. And sadly, these beds continue to be filled with better than 9 out of 10 times by the unvaccinated. Since December 29th, inpatient hospitalizations have set new daily highs, surpassing the previous record from way back on December 15th, 2020, when we were, as I'm sure you'll recall, on the very threshold of the first COVID-19 vaccines arriving on the scene. Yesterday, more than 6,500 people were hospitalized in Ohio as an inpatient with COVID-19, and more than 1,300 were in the ICU. 1 in 3 patients who are hospitalized in Ohio or are in an ICU are COVID positive. That's 1 in 3. And sadly, as I noted, the vast majority of these patients are unvaccinated. Nationally, the United States is averaging a staggering 585,000 cases a day, a record, and a 247% increase from just 2 weeks ago. This reflects the fact that Omicron is more contagious than other variants. And while the data also shows that those infected with Omicron are less likely to experience severe disease or death, with so many people getting infected, and still about a third of our population lacking the protection of vaccines, it's little surprise that we're seeing unprecedented numbers of hospitalizations. Now, Northern Ohio, especially in the greater Cleveland area, continues to be among our hardest hit areas of the state. But now we're seeing increasing challenges for hospitals in other parts of the state as well. Hospitals in Cleveland, Cincinnati, Dayton, Columbus, Toledo, Akron, and Canton have made public announcements regarding the postponement of elective surgeries and other medical procedures. Meanwhile, even Ohio hospitals that have not yet reached this state are recognizing what's likely to come and are preparing to take similar extraordinary steps to meet the demands of this Omicron tsunami. Joining us today are physicians from 2 of Ohio's large health systems and the leaders of 2 of our 3 hospital zones to help us understand what they're experiencing in their own hospitals and the regions that they serve. First, I'd like to welcome Dr. Andy Thomas with the Ohio State University Wexner Medical Center. Dr. Thomas, can you describe what you're seeing in your hospital and across that central southeastern region and how that's changed in recent days?
Thanks, Bruce. It's a pleasure to be here this morning. What we've seen over the past 2 weeks is a pretty significant and steep increase in the number of patients with COVID-19 that are being admitted to the hospital. We're seeing this not just at Ohio State, but across all the hospitals in Franklin County. If you take out Ohio Health, Mount Carmel, and Ohio State together as the 3 adult systems for the Franklin County locations, we have more patients in the hospital with COVID-19 today than we've had on any other day during the pandemic. And the steep slope of that rise does not yet seem to be backing off. But across the zone, we're also at the highest numbers during the pandemic. And as you can imagine, for smaller hospitals in smaller communities and some critical access hospitals in some of our more rural communities, they don't really have the elasticity to grow staffing, add beds, et cetera. And I think when you take the increased number of cases, now granted, Omicron in general for each individual person may be a little less likely that you're going to need to be in the hospital. And especially if you're vaccinated or vaccinated in boosters, it's incredibly unlikely that you're going to need to be admitted to the hospital. But given the rise in total numbers of cases we're seeing, even a smaller percentage of a larger number is still making for a larger number of people needing to be in the hospital. And to your point about elective surgeries, I think early on in spring of 2020, we defined what were essential surgeries that need to happen regardless. So surgeries to save someone's life, to save an organ or a limb, to prevent the progression of cancer and prevent the progression to severe pain. Those essential surgeries will continue to be scheduled. What the hospitals in Zone 2 announced yesterday, and we've been discussing this through statewide calls and zone calls over the past week, is that all of us have agreed to postpone non-essential surgeries that require an inpatient bed over the next 2 weeks. So through Friday, January 21st, we've all agreed that we could extend that if these numbers continue, but at least for the next 2 weeks, we'll try to add additional capacity by reducing those surgeries for patients that can safely have their surgery postponed. That's a pretty drastic step that hospitals are voluntarily taking, joining together in a collaboration to try and support each other so that we can have the capacity we need where we need it. Just this morning on our 9 a.m. surge call, we used to think about patients going from smaller communities or rural areas to Columbus if they needed a higher level of care or if that hospital was full. Where now what we're doing is working between hospitals in, say, Cambridge and Zanesville to share bed supply, between Gallipolis and Chillicothe to share bed supply, so that not everything needs to come to Columbus, and we can maintain the tertiary and quaternary care hospitals in Columbus for those higher ICU level care, ventilator, ECMO, et cetera. But the collaboration within the hospitals in our communities has just been outstanding. And when you add in what the National Guard is doing to support when we have staff illnesses in other parts of our region or in our hospitals to support our operations, it's been outstanding collaboration.
Thank you so much, Dr. Thomas. Let me ask you one follow-up question. As your hospitals were dealing with the cases in December, you were looking primarily at Delta. And now the cases increasingly are Omicron. Can you share with us any observations yet that you're noticing regarding any differences or changes in patient symptoms or their hospital stays as this is shifting to Omicron?
Sure, certainly. In terms of just not so much hospitalized patients, but the average patient, what I've been reading and hearing from patients is essentially a little bit more upper respiratory symptoms. So stuffy nose, runny nose, maybe sore throat, not so much the deep cough. Certainly some patients have that. I've talked to one just last evening who had a very deep cough and we put her on an inhaler, et cetera. But I think a little bit more upper respiratory symptoms, a little bit less of the reliance on loss of taste and loss of smell as a symptom. It seemed to be a little less frequent. And I think to some degree, what I've been reading from the scientists who study this and the researchers is the reproduction in the mouth and nose of this is probably driving some of this increased contagiousness as well, because there's more virus in that part of the respiratory system. So as you sneeze or cough, it's just spread a little more easily.
Thank you very, very much. Next, we're joined by Dr. Robert Wyllie with the Cleveland Clinic to give us an update on COVID-19 patient care in that northern region, which, of course, here to date has been our state's hardest hit region so far. Dr. Wyllie, we know that Cleveland continues to experience extremely high numbers of COVID patients. Could you help us understand the response in Greater Cleveland and how that response is helping us prepare other parts of Ohio?
Thanks, Bruce, and it's good to be here today. Thanks for having me on. So certainly in Zone 1, and particularly in the Cleveland area and south in the Akron-Canton area, we've been the tip of the spear in Ohio in terms of the number of cases. We started with Delta, and then we've merged into an Omicron infection on top of Delta. In fact, if you look at the counties in surrounding Cleveland, including Cuyahoga County, they had 5 of the top 13 in the United States in terms of the number of cases per day for the last couple of weeks. Fortunately, that has now dropped. And the number in Cuyahoga County over the last couple of weeks has actually dropped by about 24 or nearly 25% in terms of the cases. We hope to see the number of hospitalizations subsequently as a lagging indicator start to go down. In terms of the state, you mentioned that there were 6,500 cases hospitalized yesterday. About 3,800 of those are in the northern part of the state. And in the region, in terms of the Cleveland and surrounding county areas, it's 1,700 or 1,800, and you've got about another 1,300 in the Akron-Canton area. In terms of preparing for the rest of the state, we certainly applaud Zone 2 with what Andy Thomas just said. We stopped elective cases requiring a hospital bed over a month ago in terms of anticipating and trying to get ready for the increased demand of the COVID patients. Almost all the hospitals in the zone did the same thing. And subsequently, many of us have also begun to stop all outpatient surgeries, which are elective, even if they don't require a hospital stay, so that we could take those staff who are no longer working in an ambulatory surgery center or in those type of areas and bring them in to essential inpatient surgical areas or actually to treat hospitalized patients. I think one of the things that we've noticed is certainly the greatest number of patients by far are unvaccinated. So we just tallied up our patients in the Cleveland Clinic, and this was with individual chart reviews, making sure that they were admitted for COVID symptoms and not other symptoms as an incidental finding. So 75% of the people who are hospitalized for COVID are unvaccinated. 87% of the people in the ICU are unvaccinated, and 91% of the people on ventilators are unvaccinated. So this really echoes your warning and your urge to people in the state to get vaccinated and get boosted if at all possible. The other thing that we've done very successfully is the load balance among hospitals. And as Dr. Thomas said, this is not only just the bigger health systems, but this is load balancing even to the small hospitals. Being able to take a single patient at a time has given us the flexibility to handle a lot more patients and make sure that everybody's treated in the best way they can be. The final thing that we've learned to do quite recently with the CDC guidelines is at the end of 5 days is bring people back into work. Fortunately, I'm happy to say that over the last couple days, we've had about twice as many people come back to work, coming back to work compared to those who were leaving because of new COVID diagnosis. But you have to develop a process to do this, and I think that'll benefit the Zone 2 and Zone 3 if they become similarly affected.
Thank you so much, Dr. Wyllie. Well, I think as you have heard from both Dr. Thomas and Dr. Wyllie, our hospitals have been doing an incredible job working together to ensure the best possible patient care under very difficult circumstances. As you all know, Governor DeWine has called in the Ohio National Guard to help our hospitals cope with expanded clinical demands and to offer support throughout hospital operations to help ease some of the burden on some of our hardest hit hospitals. Today, we're joined by Major General Harris, who is here to share with us some of the many ways the Guard is alleviating some of the pressure on our hospitals. Major General Harris, can you tell us how many Guard members we currently have deployed in Ohio and some of the many roles they're filling both in hospitals and at hospital-related testing sites?
Yes. And thank you, Dr. Vanderhoff, and thank you to your colleagues in the healthcare industry who've been carrying the burden of this pandemic for 22 months now. Deeply appreciated, and thank you for the reception that our Guardsmen have received. It's been overwhelming as they've arrived in the hospitals around the state of Ohio. We currently have over 1,200 National Guard members deployed in 40 locations around the state. They're essentially operating in three different categories of functions. The first, we have medical teams deployed, and that's about 140 people in our hospitals right now. And those people are assisting at bedside or any clinical tasks that they can find that will help the hospital and alleviate that strain that's a result of this COVID surge. The second category are non-medical teams, and that's the bulk of the people that we have deployed right now. And those non-clinical teams are doing a myriad of tasks from food service, helping prepare trays, helping deliver trays, environmental services, simple things like cleaning surfaces, cleaning rooms, and turning rooms. Clearly, with the lack of beds or the shortage of beds in hospitals, the ability to get a room turned and get a patient into that room quickly is important. So our teams are helping with that as much as they can. We're helping transport patients inside the hospitals to alleviate that task from an already overtasked staff in the hospital. And of course, with just basic administrative tasks, anything that we can do to extend the capacity of the hospital to help in any way is what our folks are doing. And that third category is testing sites. You mentioned previously that the emergency departments are sometimes overwhelmed with people who are coming in for COVID tests. So partnering with the hospitals, partnering with the Department of Health and a hospital association, and establishing testing sites that may be co-located with the hospital, maybe a few blocks away, but anything that we can do with those testing sites to alleviate the strain on those emergency departments is helpful. So, for example, in Cleveland, we've helped collect over 1,000 samples a day. In an Akron site, we've helped collect over 1,000 samples a day. OSU partnered with OSU, and that's approaching 1,000 samples a day. So those are tests and samples that are being moved out of the emergency departments and then away from the hospital, so the hospital can focus on taking care of the sickest patients.
Thank you, General. And of course, the response of the Guard has been very dynamic and very responsive to changing conditions on the ground. As you're looking ahead to the coming weeks, I know the Guard is also looking around the corner, looking over the horizon regarding their response. What do you anticipate some of the future steps or next steps in the weeks to come will be for the Guard?
Well, two major things that I see that are going to be very important. First, if there are evolving missions or evolving things that we can do inside the hospitals to assist, we certainly want to make sure that we can do that. One example are our sitters, those hospital staff that have to watch those patients that may require just monitoring, just eyes-on monitoring 24/7. If we can put a guardsman on that task to free up that hospital staff to do other things, and then that can be helpful. And the other thing is we continue working with the Ohio Department of Health, the Ohio Hospital Association, to monitor what's happening with the disease. We're in the process of deploying another 1,250 service members to additional locations around the state, and we want to make sure that we array those people, those service members, in the best way possible to provide, again, help the hospitals provide the best outcomes. So we continue doing the analysis and building the matrices so that we get those folks deployed appropriately. So as early middle next week, you'll see well over 1,000 additional Guard members showing up at locations around the state.
Thank you so much, General. Dr. Thomas and Dr. Wyllie, could you share, each of you, a little bit about what your experience on the ground has been like, working with the Guard and having them deploy to assist in your zones and your regions of the state to meet this challenge?
I'm happy to, Bruce. I think General Harris has been a great partner since the beginning of the pandemic. We've been through a lot together in terms of everything from testing and nursing facilities and all sorts of other services that the Guard has provided. But I think this latest iteration that we started talking about in December, as you kind of described, has really three parts. It's some non-clinical functions when we have staff that are out ill, food delivery, patient transportation, the sitting at the bedside for patients and helping our staff free them up for other clinical duties has been just outstanding. In the emergency department, when we got the ER team together to announce that we were having some additional medics come in to help with boarded patients in the emergency department, there were literally cheers from our emergency department staff for the assistance that they were going to provide. And lastly, certainly at the swab site, as the general mentioned, we literally started on Monday with 250 patients, get the kinks out of the system. We're going to cross 1,000 patients swabbed today, and we're training Guards members so they can be dedicated to other swab sites around our region. So we're opening those in other smaller communities, so not just in Columbus. And we've been able to provide those Guard resources also to the other health systems in Columbus. So it's just been a great partnership. The nimbleness with which the Guard has been able to deploy groups of 10 across our systems has been outstanding. And really that expectation of having people open and maintain bed capacity with the Guard providing those non-clinical services has been a great partnership. Can't say enough good things about it.
Thank you. Dr. Wyllie?
Yeah, I fully support what Dr. Thomas has just said and would like to thank the National Guard, particularly General Harris, for his being proactive in helping us out. We started with a Walker Testing Center in the middle of Cleveland about 2 weeks ago. We've tested nearly 20,000 people since it opened. And now we're planning and looking at ways to even test more people who don't necessarily have transportation or the ability to register, and how do we get them into the Walker site to be tested. Our positivity rate is high, which tells you that the demand was justified. It's 38 or 39% of the people coming in are testing positive. The other thing which we shared with the Guard, as well as most of the people on this call, was we actually did a study to look at how it decompressed our emergency rooms. And there was a substantial decrease in the number of people going to the emergency departments once the Guard opened up the Walker testing site, because people weren't going and crowding our EDs just to get testing done that they needed to have done to go back to work or for school, or just to find out whether they were positive or not. So that's been tremendously helpful. Give you an example of the Cleveland Clinic for the non-clinical folks who are coming through. We have nearly 3,000 people out of the Cleveland Clinic hospitals in any given day because of COVID. That's starting to drop a little bit, but having 100 or 200 or 250 of the Guard in there to help deliver food, to help take care of patients in terms of sitters, to help patients transport, to do all the other functions you need in terms of running a hospital efficiently has been tremendously helpful. And just like Ohio State, we've seen people cheer the Guard as they've come into our hospital. It's been a very positive effect.
I want to reemphasize two things that Bob mentioned. One is at Ohio State this week, our positivity rate at our new chemical abstracts, CAS testing site on Olentangy has been over 40%, which is, if many of you will remember the positivity rate, 10% was a concerning number, 20% was a really, really bad day. And now we're over 40%. It's at many sites around the state. It's just a different territory than we've been in before. The other thing I will mention, just in terms of the cross-state collaboration, when we first started talking about allocating the Guard, Rick Lofgren, who's the Zone 3 lead down at UC Health, he and I were both very clear that we felt Bob's team, and not just at Cleveland Clinic, but in Northeast Ohio and generally, really needed that first allocation of the Guard there because they were clearly a couple weeks ahead of Central Ohio. And I think Central Ohio is probably a 10 to 14 days ahead of Southwestern Ohio in terms of the impact of this Omicron variant. So I just think it's been a great collaboration between the zones and between the hospitals to make sure that we were putting it, the Guard resource into the hospitals that needed it the most.
Well, thank you very much. Well, Omicron is here and it's causing record numbers of infections, pointing toward a very challenging January. Infections at the high rate that we've described will certainly strain our already taxed healthcare delivery system and will undoubtedly have ripple effects throughout our communities, including impacts on businesses and schools. But we're also hopeful because every day more Ohioans are getting vaccinated or boosted. In fact, tens of thousands of Ohioans every week, back to the first week of November, have chosen to start their vaccination. And it's clear that COVID-19 vaccines remain a powerful shield against severe illness and death. COVID is not going away. It's with us for the long haul. And the best way to protect ourselves is to be up to date with vaccination. Vaccination, appropriate testing, staying home if you feel the least bit sick, masking, especially in crowded indoor environments, proper ventilation, and regular hand washing all can help prevent the spread of COVID-19, as well as other respiratory illnesses like the flu this winter season. Of course, keeping your vaccination up to date means getting your booster when advised. If you received the Pfizer vaccine, you can now get a booster a little sooner, 5 months after your last dose. If you received the Moderna vaccine, you can get boosted 6 months after the last dose. And if you received the Johnson & Johnson vaccine, you can get boosted 2 months after the first dose. This week, the FDA and the CDC also took important steps to add to the protection for our children. Now, children ages 12 and up can get a booster dose. In addition, younger children between 5 and 11 who have certain immune compromising conditions can also add a dose to their primary vaccine series. This offers another important layer of protection to keep our children safe when they're home or in the classroom. More than 6.4 million Ohioans are fully vaccinated, and more than 2.8 million are boosted. If you're among these many Ohioans, you can feel confident that you have very good protection from severe COVID illness. If you're unvaccinated, you're not only at greater risk for getting COVID-19, you're much more likely to develop a severe illness, which could be life-threatening. To those who aren't yet vaccinated, please take the time to talk to your healthcare provider, get the facts, and make a decision that will protect you and those you love from the spread of COVID-19. Finally, as we've already discussed, if you have symptoms of COVID-19, including cold-like symptoms, or if you test positive even without symptoms, it's important to isolate yourself to further reduce the spread of this virus across our communities. Even little or no symptoms, if you test positive, puts you in a position to potentially pass the virus along to someone else. And that someone might end up with a much more severe illness. So if you aren't feeling well, even if it just seems like a little cold, or if you just test positive, please stay home. Prevention is key. Protect yourself, your loved ones, your community by taking these important steps to help control the spread of COVID-19. So thank you. And Michelle, I think we can now open up for questions.
Thank you, Dr. Vanderhoff. Our first question is from Dan DeRose with WOIO.
Good afternoon, gentlemen. Thank you very much for the time yet again, giving us some clarity. I want to start my question off by saying that there's been nothing positive about COVID. There's been nothing good. But in the past couple of weeks, I've done a couple of interviews with Dr. Keith Armitage from University Hospital's Roe Green Center for Travel Medicine and Global Health. And we've been discussing this idea that perhaps there is a silver lining to Omicron being so contagious, and with most people probably going to come into contact with Omicron at some point. Can this help us get out of this pandemic by herd immunity, because so many people, even vaccinated people, are going to come into contact with COVID? Could you share your thoughts on that subject?
Yeah, Dan, I think that's a really good question. And I think there is hope. Of course, projecting into the future and being able to say with any kind of certainty is not possible with an evolving virus. But there are really strong indications that, particularly for people who are vaccinated, the advent of this new Omicron could have a silver lining. There was a report I mentioned in a previous conference before the holidays coming out of the Journal of the American Medical Association, a very good study that showed a profound, robust immune response that occurs in people who may encounter Omicron, but are already vaccinated. That points to a kind of boosting phenomenon from this for those who already have a good underlying foundation of immunity from their vaccines. They really could begin to move this toward an endemic illness. I'm not sure that we would characterize that anymore as herd immunity, but more creating a situation, especially in populations where large numbers of people are vaccinated or are getting vaccinated, in which the future of this virus is to be much less dangerous, even though it continues to circulate among us. So I've got two physician colleagues on here who also study this very closely. Let me open it up to them.
Bruce, I would agree with everything you just said. I think in my mind, I would rather have herd immunity through vaccination than putting people at risk, since there is a chance when you're unvaccinated and you get this that you end up in one of our hospitals or ICUs. So I think a better way to get there would be through immunization. That being said, I think the more important thing around the Omicron variant is just the less severity of illness on average. That's part of the probable progression of a virus like this into being, as Bruce has described, an endemic virus that it's almost the equivalent of a cold virus eventually, like so many other coronaviruses are, as opposed to what we originally saw, which was a far more virulent, serious illness in the average patient.
I fully agree with what's been said as well. I think vaccination is clearly the way we want people to become resistant to the virus. But saying that, we were having a very difficult and challenging time with the Delta virus. And we've seen a virus which is much more infectious, but much less severe by all signs in our current data than Delta. And yet it's starting to wipe out Delta. So we're seeing very few Delta cases at this time, almost all, nearly 100% Omicron. So in that way, it is a silver lining, end quote, in terms of the new infection.
Thank you, doctors. Our next question is from Dear Simon with WHIO.
Kind of along the same lines as Dan's question, we've seen in South Africa, like cases just steeply drop. Is that something that you guys believe we will see here in Ohio as we, go through this quickly going up phase that we are currently in? How close do you think we are to that peak, just given the sheer numbers game that, you have to look at in this situation with so many people getting infected and it happening so quickly? It seems like the numbers are really what we need to be watching too, to see if we reach that peak. Is that something you guys would echo? What would you guide with on that?
Yeah, thanks, Drew. Again, I think another very important question, and I'll open up with some comments. I think first turn to Dr. Wyllie up in Cleveland. I think that we would all hope that we are able to enjoy the same kind of pattern that we've seen in South Africa. But it's important to recognize that there are differences between the populations in the United States, in Ohio, and the population in South Africa. One of the key differences between those populations is a difference in the average age of the population. And the simple fact is Ohio is a bit of an older population. We don't know what differences like that will mean in terms of this wave of Omicron. But it certainly has been encouraging that the Omicron wave was able to recede almost as quickly as it arrived in South Africa, and we'll hopefully look forward to that. Having said that, the reality is that on the ground right now, Ohio is facing an historic challenge in terms of the incredible demands and pressure placed upon our hospitals and our healthcare delivery system. This is as serious as we have seen, and our hospitals are having to go to extraordinary efforts to be able to provide beds and the needed care to the sickest patients across our state. So I think the most important thing for us to focus on now is what we can do at this time to make a difference. We've described that, and of course, it begins with vaccination. Remembering that while vaccination takes a while to have an impact, I want us to remember that this virus is not going away. Yes, right now we're dealing with Omicron, but it has been clear and becomes continuously clearer that with variant after variant after variant, our best defense against severe illness has remained getting vaccinated. So with that, let me turn to Dr. Wyllie, because they've been on the front end of our curve, and I think he has some good insight into some of what they're beginning to see in terms of some data shifts. Dr. Wyllie?
Yeah, thanks, Bruce. Certainly, as we look at the South African data from the time it was recognized as a problem, not for the time retrospectively the first cases were diagnosed, but from the time it was recognized until a peak in South Africa was about 25 to 30 days. That's about the window we're in Northern Ohio right now. As we look at the cases in Cuyahoga and the surrounding counties, we've begun to peak, and in Cuyahoga County, we've actually dropped over the last 7 to 10 days in terms of the number of new cases per day. As Dr. Vanderhoff said, the one mitigating factor is that the South African population is about 10 years younger than the population in the United States in general. But Ohio is actually older than the average state, particularly the average large state with a large population of over 10 million. So we're more likely to see a lingering effect of the Omicron and a little bit more severity of the Omicron affecting older people as opposed to younger people. But we're keeping our fingers crossed that the same decline that they saw in South Africa, that we will see a decline. Maybe not as sharp, but we hope to see a steady decline. And I think we've got the first inkling of that in Northern Ohio right now.
I think I agree with everything Bob just said. I think what I would probably like to add would be two things. If you look at some of the IHME modeling, it looks like Ohio as a state will peak towards the end of January. But as I described with the hospital census, Northeast Ohio is probably 2 weeks ahead of Central Ohio. Southwest Ohio is probably 10 days to 2 weeks behind Central Ohio. So I think you're going to see this shift through the state over the next month, essentially. The other, I think, confounding factor all this is the beginning of K through 12 schools. I know in Central Ohio, we've been really pushing, and I know the state's children's hospitals and us as zone leads have been pushing across the state for K through 12 schools to understand that while vaccination is the best long-term strategy for managing this illness, face masking is the best short-term mitigation for this, and the risk of this not running rampant through a school system. If you have especially unvaccinated students that are together in close proximity without masks, you're just likely going to have a significant rise in cases, which will mean sick children at home not learning, which is not what we want, or schools going virtual, which is also, I think we all have agreed that kids are better in the classroom. So you end up then with parents who can't go to work because they have sick children at home, or children doing virtual school at home, which impacts employers, not just like us as hospitals, but all employers across our areas. So I think the K through 12 school boards, school superintendents, just taking this message seriously that masking works.
Our next question is from Joe Ingles with Ohio Public Radio and Television.
Thank you, doctors, for doing this. I want to talk about the lack of antigen tests. The new CDC guidelines involve 5 days if someone's not still having symptoms. But many people have symptoms of COVID all winter long. So when they get COVID, it's really hard to determine when they're no longer contagious. They need antigen tests to do that, right? Because the PCR test can't determine that. Can you speak to that? And also, is there a supply of antigen tests somewhere or a plan to hold any of them back for this express purpose?
Yeah, thanks for that question. Of course, the demand for antigen and PCR testing nationwide has skyrocketed, and that's certainly true here in Ohio. There's also, unfortunately, a national constraint or national challenge as it relates to the availability of these products on the market. In Ohio, though, we are testing an extraordinary number of people. And I think everyone will recall that Ohio really led the way, was very much out in front of the curve in purchasing tests early last year, and then throughout the pandemic, distributing essentially at-home tests to people at rates that really have exceeded what most other states have been able to achieve. We've given 5.7 million of our Binax Now at-home tests out to date. 1.4 million of those in December alone. And if you just look at the first week of January, we've pushed out 400,000 free tests just in that week. Add to that if you look at any given week, and you've heard some of the measures that we're taking, including working with the Guard to increase test availability, 88,000 people are tested every day. And I think that's actually a pretty remarkable accomplishment. In terms of what test is the best test to get, I would say it's the best test that you're able to get access to in your community, because PCR tests are very good tests, and we have shortened the turnaround time for getting people results dramatically compared to where we were early on in the pandemic. So I would not discount the kind of PCR testing that we're able to do through many of our testing centers and laboratories. But my two colleagues have a lot of frontline experience with testing and getting testing out to the community. So let me turn to them, beginning with Dr. Wyllie. Dr. Wyllie, what would you add?
Bruce, I agree with your comments. Overall, we have given out, not only at the Walker site where we're doing PCR testing, but to people in line. We have distributed the testing kits in terms of the Binax Now and the other home kits available to anybody in line who wanted one. And we've distributed thousands and thousands over the last 14 days to those people as well. We'll certainly agree that around the United States and even in Ohio, despite the huge numbers that Dr. Vanderhoff just described, there's still probably more people who want to be able to test at home than the kits available. Given that, I think the medical community, as you've probably seen, is a little divided about whether you should test at that 5 days or not, with the AMA saying that testing would be preferable and the CDC making it relatively optional. So I think the instructions are a little unclear now. I think for healthcare workers going back to work and wearing an N95 mask, you can safely do that because you're protecting yourself and others from spread by the quality of the mask that you're wearing. In public, people really need to know that if they're going to go out after that 5 days or 7 days of quarantine, that they mask up for the additional days, because there's still a slight degree of viral spread in the last 5 days of that 10-day course.
Yeah, Bruce, I don't particularly have anything to add. I was just going to reemphasize the point that Bob just stated, and that days 6 to 10 after your infection, you still do need to mask when in public around others.
Our next question is from Sarah Shookman with WKYC.
Good morning, everyone. I know you have talked about just how overrun ERs are. We've heard from patients and employees at some of our suburban hospitals, Cleveland Clinic hospitals, about patients having to be treated in waiting areas or being turned away because they're not sick enough. Is this just the reality of the situation, or what should people know about this?
Let me first say that we've been talking about now for weeks the real challenge that these incredible volumes are creating for our emergency rooms across the entire state. And our emergency rooms, the physicians, the nurses, the other staff that are working in those settings have really gone to extraordinary lengths to provide care to patients and to assure that those most in need are getting the care that they need. In terms of specifically what this looks like on the ground, let me turn to my colleagues. You mentioned the Cleveland Clinic, so I'll turn to Dr. Wyllie first.
Sure. So first, let me emphasize that nobody's being turned away from an emergency department. And what we have is as we have all these COVID patients coming in and the other patients with significant illness that need to be hospitalized, if there's no room to put them up on the floors of the hospital, then they have to wait down in the emergency department. The reason that some people are being seen in the waiting room is because there's not additional rooms in the emergency department, because some of them are housing patients which are waiting to get a floor bed. So rather than just let these patients sit there and nobody paying attention to them, we put our staff out in the waiting areas to triage them to make sure we're not missing anybody who's having a heart attack and needs immediate intervention, or has symptoms of a stroke, or who needs oxygen therapy because they have COVID. So that's intentional. It's not by accident that we're moving into the waiting areas and making sure that we touch base with everybody who's there to make sure we can do a rapid assessment and take back the sickest people that we need to take back to and attend to them immediately.
I would agree with everything Bob said. I know just this morning on our zone call, I tabulated as we went through the 40 plus hospitals and health systems in our zone. We had approximately 240 patients in the emergency departments in the hospitals in my zone of the state that are admitted to the hospital waiting on a bed. It's called being an aborted status, or you're boarding in the emergency department. And there are well over 100 patients that were on transfer lists to be sent to another hospital, often to Columbus, that are waiting for a bed at another hospital for a variety of reasons. So we've been talking about this for weeks, that this is eventually where the situation gets to. And I can tell you the hospitals in my zone aren't even in the worst of it yet. What Bob's hospitals have gone through over the last couple of weeks, we think is actually coming to Columbus. I know over the past few days, we've been on what's called citywide diversion, when more than 3 hospital emergency departments in Columbus are on a divert status because they are so full they can't take more squads. We revert to a round robin process in Columbus where everyone shares the volume, and the fire department works to make sure that patients are getting to where they need, but we do it in a shared fashion amongst all the 3 health systems. So it's essentially the consequence of what we've been talking about for weeks, Sarah. So I appreciate you for bringing it up.
Thank you.
Our next question is from Lindsay Mills with 10 TV.
Good morning. Many people are deciding to upgrade their masks from cloth ones. and looking for some guidance on how to go about choosing the best one. We know that there can be some counterfeits out there. I myself just went on Amazon and bought the first thing I saw without even thinking about it. And I know the CDC has some guidance on how to spot a counterfeit, but what's some guidance for our viewers today if they're upgrading their masks?
Well, thank you. A great question. It's one that a lot of people have now, and it's an important one as people consider the way to protect themselves and people around them. The key to preventing the spread of this virus, which can be spread through very, very tiny droplets, aerosolized sized droplets, is to have a sufficient barrier to those being transmitted, and yet good air movement so that you're able to breathe. Now, there are different ways to accomplish that, but more and more experts are pointing towards the benefit of medical grade masks. There is some range of the effectiveness of those medical grade masks, but they all have characteristics that improve their ability to protect you. So we're pointing people more and more towards those loop surgical masks, or even stronger protection coming from the various N95, KN95, and there are other counterparts to that N95 type mask. Now, there's some challenges to those masks in terms of they require a proper fit. They can be very, very tight. But what you get from the so-called surgical mask is 3 layers, one of which is a polypropylene layer that is electrostatically charged. And that does have an added benefit in terms of the level of protection. So, if none of those are immediately available to you, multiple layers of a cloth mask are certainly better than not having a mask on at all. But at a high level, that's what we're currently observing and recommending. I don't know if there are any additional points that my colleagues would like to make. Great. I think.
Yeah, Dr. Vanderhoff, I think you summarized it well.
Thank you. Our next question is from Roosevelt Leftwich with Fox 8.
Hey, good morning, everyone. You touched a bit on it briefly when you were talking about when this thing may peak, or where you're starting to see some signs that things may be starting to level out a little bit, especially in Northeast Ohio. But schools also seem to be the worst combination for this, where you have unvaccinated and vaccinated people in small spaces. A lot of schools are already remote right now. Some schools have gone back into session with mask mandates. Is there any idea when we can expect, or we may see this thing to start peaking when it deals with school children especially?
Well, I think it's a great question. I think that we're likely to see the same pattern in terms of our regional schools that we're seeing in those regions as a whole. The schools are an important microcosm of the greater community whole. And I think one of the things I'd like to emphasize about our schools is this: we look at the month of January. We're looking at a month where we are going to see very high community transmission, very high caseloads of COVID-19 driven by this Omicron variant. That's just a fact that we can't avoid. And we know from a lot of experience what the best steps are to assure that our kids can stay in school. And there are so many indicators that the best place for children is in person, in school, for their education and their overall development, not just their cognitive development, but also their comprehensive development, including their emotional development. And so we want to keep our kids in school, but the way to do that is to have consistent masking, and the other safety measures that our schools, so many of them, are undertaking, including maintaining safe spaces, good ventilation, et cetera, et cetera. So we have the tools, in addition to vaccination, to make January a good school month, despite the challenge in front of us. But it really requires that we utilize all of the tools that we have at hand.
Thank you.
Our next question is from Jamie Ostroff with WCMH.
Good morning, everyone, and thank you so much for taking my question. I want to talk about these at-home tests. As you're aware, I'm sure there has been such an incredible demand for them. Dr. Vanderhoff, you just said 5.7 million of these tests have been given out recently. And if you go to any pharmacy, you know those shelves are bare. They are flying off the shelves. So my question is, how does all of this at-home testing impact the ability to track the spread of COVID and, in effect, adjust the state's response accordingly?
Yeah, thanks. Another great question. And there's no question in my mind that the testing numbers, the total case count numbers that we see, and they're extraordinarily high, are in fact even higher than what we're seeing, because it is the case that many times these at-home test results, when they're positive, are not reported in, are not collected as part of our overall public health data. However, I think that when you consider the fact that we have 88,000 people being tested a day, while a lot of testing is happening through at-home tests, we're doing a tremendous volume of tests that are in fact being recorded. And those case numbers are important because of the context. They tell us about the direction that things are going. Far more important for our analysis when it comes to very specific numbers are our hospitalizations and deaths. And those we have incredibly accurate data on. The fact is, we already know that Omicron is spreading and spreading at incredible rates. So we have the information we need to understand where we are on the curve of Omicron and COVID-19 transmission from the data that we collect today, even though it's undoubtedly incomplete. More important for absolute completeness is our data regarding the hospitalizations. And thanks to our very close collaboration with the Ohio Hospital Association, we have excellent data collection across the state in that arena.
Thank you. Our final question for today will be from Titus Wu from the Columbus Dispatch.
Hi, thank you for doing this. So my question is, I know we've talked a lot about kind of COVID-19 hospitalizations, and of course that's very important. But one thing I wanted to ask about was kind of COVID-19 deaths. Right now, according to New York Times data, Ohio is ranked second in the nation for COVID-19 deaths per capita. I was just wondering, on the ground, are you guys also kind of seeing more deaths related with COVID-19, and maybe any reasons as to why Ohio right now is ranked as high as it is on deaths?
Yeah, thanks for that question. Well, I think one of the things that one has to consider, whether one is looking at hospitalizations or one is looking at deaths, is the context in that geography. And the fact is that Ohio and the Great Lakes region of the upper Midwest, spreading up into parts of Pennsylvania and New York, has really been the epicenter of the winter Delta surge, then followed close on its heels by the arrival of Omicron. So looking at distinguishing Ohio from that context really doesn't make a lot of sense. I think really what we're looking at in terms of any of that death-related data is that Delta surge that that we've just been living through, and that hit, of course, during the winter months when things are the most severe. So that's the context. Again, when we look at the causes, when we look at the demography of that, again, we're looking at a picture of a dramatic, disproportionate impact on people who are unvaccinated. across the state of Ohio. And so our message really is the same. Look, there is a great way to protect ourselves from serious illness, including hospitalization and the worst outcome, death, and that is to get vaccinated. We are making great progress day after day, but there's more room to go. And we would like to see that last third of our population consider affording themselves the same protection that the rest of the population has afforded themselves.
Thank you to our guests today. Dr. Vanderhoff, do you have any closing remarks?
Well, thank you all for your continued interest in this very, very important topic. I want to remind people of the importance of vaccination and the importance of masking and safe behaviors as we are dealing with the Omicron surge across Ohio. Thank you again, and thank you to my guests for joining us here today.
Thank you. This concludes today's press conference. Thank you again for joining us.